During this pandemic, we're seeing how some people fare better than others through the coronavirus, and that means what health means for one body is not the same for another.
You can't really base what you want to do for you based on what's good for somebody else. This is the problem with the fad diets and all that kind of stuff, Oh, I read about this diet or that diet and that helped so-and-so. Okay, great. I'm glad that it helped so-and-so, but is it going to help you? Do you know that it's
Pandemic stress on top of our past health issues can be misconstrued as new health problems.
that out? And a lot of times people don't realize that something from the past actually is bothering them today until you actually force the issue to discuss it. And they realize that perhaps I am doing X, Y, or Z because of that from the past.
Personalized medicine is like detective work, piecing together all of the parts of a puzzle to give us the whole picture toward wellness.
And if we don't address some of these things, then we may be missing a big piece of the puzzle.
Aloha mamas, and welcome to the CoronaMama Zoom Room. This show is brought to you by the Maui Mama magazine. And we are here for you, the Maui Mama, to help you to connect and express and share all those things that are on our minds during this pandemic time. Our motto is #share aloha, not corona. I'm Angeline Chu Longshore, and today we are talking about being well. So something called well care as opposed to sick care. And this goes along with our proactive pandemic series. So speaking of the pandemic, I want to address something. You may not have realized it, but we are in the beginning of the end of the pandemic. That's right. So what's going on that you may not have thought about is that, okay, we have now this rollout of vaccines, and then after that will be treatments. And so I'm just seeing the light at the end of the tunnel. We are at the beginning of the end. That said, though, we are in probably the highest numbers that we have had in Maui as far as cases, daily average cases. So we are not out of the woods. So I just want to address those two things that are really interesting. So we still need to be cautious. We still need to have our safety protocols in place because it could get worse. So with that said, we are in this end of the beginning of the end. And so for me and for the CoronaMama show, that makes me think about what we want to do next. We'll be in this new mode, and I call it the discovery mode, where we're discovering where we are now in life, what we need to know now to navigate life. And that is the name of the show that it will be and my new podcast that I'm launching. So you can listen to the CoronaMama series and future series episodes on the Discovery Mode podcast. And you can also watch it on the Maui Mama magazine page as the Discovery Mode podcast once we transition out of the CoronaMama, pandemic time. So that'll be a few months from now still. Just wanted to let you know that's where we're going. So we will still bring you interviews from experts all over the world, which is what we've had. We've had people come forward from all over the world to help us out during this pandemic with really great information. And what I love about that is that we see that people all over the world care about us in Maui. And that's because we are literally in this together, in helping each other and helping the world to heal and to move forward through this pandemic. So that's been the beautiful silver lining here. And we will still bring you interviews from experts all over the world as we move into this discovery mode. So just want to tell you that's where we're headed. And so for today, I have something really exciting for you. There are a lot of really local kind gifts that we can get at the last minute. So for our stockings and for gifts that maybe you need to grab, there's a lot of sales and deals. So at the end of the show, we'll show you all of that. And for our main segment today, we're talking to Dr. Marvin Singh. He is an integrative gastroenterologist in San Diego, California. He's a member of the Board and Diplomate of the American Board of Integrative Medicine. He's also trained and board certified in Internal Medicine and Gastroenterology and Hepatology, a graduate of Virginia Commonwealth University School of Medicine. He completed his residency training at the University of Michigan Health System, along with fellowship training at the Scripps Clinic Torrey Pines. Singh was trained by Dr. Andrew Weil, the famous Dr. Andrew Weil, a pioneer in the field of integrative medicine at the Andrew Weil Center for Integrative Medicine. And he's currently the director of the Integrative Gastroenterology at Susan Samueli Integrative Health Institute at UC Irvine, and also a voluntary assistant clinical professor at UCSD. And prior to this, he has been a clinical assistant professor at UCLA and an assistant professor of medicine at Johns Hopkins University. He is currently a member of the American Academy of Anti-Aging Medicine, American College of Lifestyle Medicine. He's actively involved in the American Gastroenterology Association, one of the editors of the textbook of Integrative Gastroenterology as part of Andrew Weil's series text, and has written several book chapters and articles. He's dedicated to guiding his clients toward optimal wellness every step of the way, using the most cutting-edge technologies to design highly personalized, precision-based protocols and to help them stay on top of their health rather than what he calls underneath disease. So let's bring Dr. Marvin into the Zoom room. Aloha, Dr. Marvin. Welcome to the CoronaMama Zoom room.
Hi, aloha. How are you?
I'm great. So why don't you introduce yourself and tell us what you do, what you're all about?
Well, my name's Dr. Marvin Singh, and I am an integrative gastroenterologist. So that means I've trained in internal medicine, gastroenterology, and I'm also fellowship trained in integrative medicine. I trained with Andrew Weil at the Andrew Weil Center for Integrative Medicine in Tucson. And that's who I am, I guess, in a little nutshell. I currently have many hats that I wear. I have a general gastro practice, and I have a precision medicine practice, which is my little baby that I started called Precision Clinic. And also the director of integrative gastroenterology at the University of California in Irvine.
Wow. Okay. So we are so fortunate to have you here. And I stumbled upon Kieran Kirshnan, your friend, and he introduced me to you. And so we've heard a lot about the microbiome from his perspective in breaking it down and what it is. But there's so much more. There's so much more down that rabbit hole that I know that you can shed light on in a really what you're calling a personalized way.
Definitely. And I think, this pandemic really brought about this awareness of being proactive about your health. It's not really just all only about the pandemic itself, but I think people realize that there are certain things that they should probably be paying attention to so that they're least susceptible to having health problems. And the pandemic was really just I guess the impetus or the cause for people to start realizing this. These are things that I and people like Kieran and a lot of other health advocates have been talking about for a long, long time. But I think, you have to try to look at the positive in every negative. So one of the positives you look at in this big negative of this pandemic is that maybe people will be a little bit more aware about health and wellness and what true health and wellness really means and how to achieve that and attain that, because I'll tell you, this is not going to be the only pandemic that this planet Earth is ever going to see. I mean, maybe it'll be the only one that you'll see in your lifetime, but you have kids and their kids and their kids to worry about too. So this is a great opportunity to kind of realize what it really means to be healthy.
Mm-hmm. And in this country, we're seeing that it's those micro imbalances that really are making the difference, because there are people who we think are healthy. We think of ourselves as, oh, I exercise, I jog, or I do these different things. But we really have to look deeper, because some of those people are getting COVID and having serious reactions to it. And they are surprised because they think they're healthy. So I think what's really interesting that a lot of people will identify with is your story.
Yeah, I mean, when I started working as a full-fledged doctor, my first job was at Johns Hopkins as a faculty member there, and I learned a lot about the practice of medicine there, but I also learned that a lot of people kept coming back over and over again. And, they would see you as maybe the 10th doctor they've seen or the 30th doctor they've seen, one person told me, and just keep bouncing around from doctor to doctor looking for answers to how to solve their health problems. And I realized that we do a really great job at taking care of people when they're sick and dying, like they're hospitalized or they get in an accident or they have a heart attack, or even if they have cancer, there are treatments, there's things that we can do. But that's not the case for a majority of the people. Majority of people have these kind of lingering chronic symptoms that, either we'll say it's autoimmune or we don't know why you have it, and just take this medicine to kind of cover it up. And so that kind of was frustrating to me. And in this whole process of trying to learn how to deal with that, I started studying integrative medicine. And in that process of studying integrative medicine, I realized that I myself was probably not doing all the things as well as I could be. I'm a doctor. I thought I was eating healthy, doing the right things. I didn't go to Wendy's for lunch, but I might have had a sandwich and a bag of chips with a Coke Zero, because Coke Zero is better than Coke, right? So, some of these things you learn by educating yourself in areas that you may not have really been taught very well. And I started to realize that when I started applying some of these principles that I was learning about nutrition and mindfulness and exercise and proper sleep hygiene, stress reduction, when I started applying these principles to my own health, I started seeing some really great changes. Within 3-4 months or so, I lost 30 pounds. I was feeling more energetic. I was more relaxed. I was sleeping better. I was more motivated to exercise more because all those other things were also happening. And it was really kind of like the switch went off in my head. I was like, these are such basic things that we need to, that exist, things that we can do. And many of us don't do a lot of these things. And this could be driving a lot of our problems. And so I really became a big advocate on lifestyle practices and how they can influence our health. And then, using more natural treatments for certain things also helps, because if you can take some of the drugs and medications away that could be contributing to some other symptoms, then you also have another victory in that regards as well. Because sometimes the medicines we take are causing problems, and then we have to take another medicine to fix that problem and take another medicine to fix that problem. So, if we can do things a little bit more comprehensively using integrative practices, then it's a win-win for everything. And as I have said before, just how you can feel that your health can snowball out of control, it can also snowball into control. So once you start finding that, certain things are getting better, it's kind of a cumulative effect. Things continue to get better and better and better, and that allows you to do different things, and then you can build on that experience and start to feel that you have some control over your health. And this is what really brought me to write the book that I'm writing now, called Own Your Health, because that's what it's all about. It's about owning your health. It's about learning yourself and learning your body to be able to take control over things and really listen to what your body needs and give that to your body.
I love what you said about things can go, I don't know exactly how you said, but out of control and spiral out of control or spiral into control. And I'm thinking about where you were when I had read you were maybe around 200 pounds and you had fatty liver and maybe some cholesterol issues, and you were a doctor.
Mm-hmm.
And so each one of those things, drinking the Coke Zero, maybe that one particular thing is not a big deal. But when you had so many other issues, that spiraling out of control is something that we don't realize happens. That's, like you said, cumulative. But I really think it's so fascinating, the spiraling into control, because we think, oh, what's it going to matter if I take away that Coke? What's it going to matter if I do a walk for 5 minutes? But are you saying that those things add up? Is that what you're saying?
They add up, and as you start doing them, and I never push people to go, from zero to hero. I mean, you're not going to run a marathon the first day you decide you're going to exercise, but you start doing a little bit. I used to tell people, just pick one thing a week to do. Um, Whether that's you're going to eat blueberries instead of chips with your lunch, that's fine. That's one thing, and if you do that one thing different or new every week over a year, you'll have done 52 different things that are new. And what you'll find is that, if that's all you did, then you definitely have made a lot of changes in a course of a year, 52 things. But what happens is, you set that goal of one thing a week, and you'll discover that after a few months, doing new things that are better for your health becomes easier. And instead of doing one thing a week, you may end up doing 2 or 3 or 4 things in a week. And so that's how you cumulatively, as time goes by, can start improving much more rapidly. Once you let it rip, it'll keep on going. Especially as Americans, I think we are very used to problem equals solution, therefore fixed. But the body is not so dumb to be working like that. The body couldn't work like that, because if there was a one-to-one for everything, we could fail as healthy beings very easily. Because it's like, oh, well, if you have a B12 deficiency, then you will die. I mean, the body doesn't want that to happen, right? It's not going to be one problem and then, the end of the road. There are so many fail safes in the way that the body is created, and at the same time, so many things that you need to do to optimize things. It's like a snow globe. So this is how I correlate it, and how what I kind of discuss in the book that I'm writing. It's, imagine you have a snow globe, and what happens when you shake the snow globe? All the snowflakes start flying around everywhere, right? It looks real nice. So when you say, I have constipation, just pick something. You shake the snow globe. All those little snowflakes could potentially be issues that are contributing to your constipation, not one snowflake.
Mm.
So if you do something that shifts the snowflakes in one direction, what happens to the other snowflakes? They may shift and do other things as well. So you have to really keep in mind that it's not so simple as do one thing, drink water and more water, and you'll have constipation relief. There are so many things going on in your body. There's genetics, there's environment, there's stress, there's diet, there's sleep hygiene, there's what you're putting in your body, what you're being exposed to. So many different factors and elements that if you really don't take those into account, you may not really get the whole picture. You may not really solve the problem as well as you could. We can do things that can create a solution. You could take Miralax, like a conventional physician might say, to help with your constipation, but Miralax is a chemical. What happens in your body when you do that? What's the response to that?
Snowflakes start proliferating from that
A lot of
chemical.
these answers, we don't may not necessarily know all of the answers to these questions, but these questions need to be posed, because this is why we have people on 10 medications, for example, because you take one medication, you take an antidepressant because you have depression, but then you get nausea, so then you take another medication, and then that medication causes another problem. Take another medication, so you end up maybe needing 5 medications to treat one problem. And ideally, it would be nice to address where the root cause of that one problem comes from and deal with it from there. Because in the long run of your life, that may be the most effective actually for happiness and longevity of your well-being. And so this is where this concept of precision medicine came when I started to develop my new practice called Precision Clinic. It's, we want to look at all of these factors. We want to look at your lifestyle. We want to look at your toxin exposures. We want to look at your genetics. We want to look at your microbiome. We want to look at your inflammatory markers. We want to look at your mitochondrial health. We want to look at your sensitivities. We want to look at all of these kind of things. And then when you have all that information together, I put it all together, I piece it all together, I analyze all of these pieces of the puzzle together at one time so that I can understand where some patterns and correlations are, so I can guide you on what are the things that you can do, lifestyle wise, diet wise, what deficiencies do you have, what supplements might you need, what do you need to do to beef up your microbiome or your gut health. Because it's not just one thing. You may go to somebody and say, I need an evaluation, and they'll say, okay, we'll do a gene test. And they say, okay, well, we did a gene test and you have this and that, so let's do these things. And that might be good, but that's just one piece of the puzzle, because if you haven't really analyzed all the other things, you're just ignoring them. So you got to kind of look at the whole thing. And I guess this was a long explanation for me basically trying to say that the body is very interconnected with many different components, and you can't just look at one thing in isolation to find an answer. We might want to. That's maybe what would make us happy if that was the case, but the body is not designed like that. There's too many things going on for it just to be a one-to-one.
And now that we're in this pandemic time and people are extra stressed and having even more issues because the stress causes issues too,
Right.
really paying attention. And I mean, it seems like the time when we really need to start doing this personalization of our medical wellness and really looking at that.
What matters at the end of the day? You are what matters. And you can't really base what you want to do for you based on what's good for somebody else. This is the problem with the fad diets and all that kind of stuff, Oh, I read about this diet or that diet and that helped so-and-so. Okay, great. I'm glad that it helped so-and-so, but is it going to help you? Do you know that it's going to help you? What evidence do you have that it might help you, that it might be good for you? None, other than the blog looked like a good blog and I like him. That's really the basis of medical decision making these days. And so what I like to teach people about is that we can try to find some answers that are good for you and personalize it for you, because what you're eating, what you're doing, how you're living is for you, not for somebody else, not for somebody's blog or for their followers. It's for you.
With your patients, can you tell us some of the cases that you're seeing from where they came into what the result was?
Somebody who was dealing with fatigue and weight gain or inability to lose weight, skin and hair issues, and really just kind of felt like they didn't have any control over what was happening, and it was making them progressively upset as well at the same time. And so we kind of, peeled back the onion on all those various layers and realized, that there was some imbalances going on in the gut. There was some nutritional deficiencies, and really worked through some of the issues from the past that were holding this specific person back, and dealt with some of the stressors that were going on. I mean, there's no test that's going to tell you what stressors are bothering you. It's a matter of discussion. You have to kind of figure that out. And a lot of times people don't realize that something from the past actually is bothering them today until you actually force the issue to discuss it, and they realize that perhaps I am doing X, Y, or Z because of that from the past. And so talking about that, and working through some of these issues and putting this person on a specific regimen that I created to help improve the mitochondrial health and gut health and fix some of the deficiencies. Within, I say, 3 months or so, this person made some remarkable changes. They were eating much better because we cleaned up the diet. And that allowed them to feel more energetic, and motivated them to exercise more. That caused their sleep issues to improve because now they could sleep better. And then fixing some of the deficiencies by adding in some of the supplements and gut supportive things that we talked about just kind of accelerated this whole process, and the weight loss started. The mood lifted, and really this person reported that they were a brand new person. The skin issues, the rashes, the reactions really just kind of melted away. So this is a classic example of how things can snowball into control once you start giving your body the right ingredients, the things that it needs needs to function properly. The question is, what does it need? What does your body need? What is missing? What could be improved? And that is really learned by the process of doing these investigations that I do. I have a story of one that was just probably purely psychological, of a patient who came in a wheelchair, a young person, complaining of difficulty swallowing. And I've told this story before, but basically I said to this person, why are you in a wheelchair? Because I don't see any kind of neurologic diagnosis on your medicine, your past medical history. Were you in a car accident? Do you have some spinal cord injury, or what's going on? And they said, no, I never had a car accident. I just it's easier for me to get around. I don't feel very steady. So that was interesting to me. Why is this? This person was like in their 20s too. It's not like it was
Oh,
an
wow.
old person. Yeah, this is a young person. And then we talked about the swallowing and, being a GI. Yeah, somebody's saying they can't swallow. We investigate. We do an endoscopy. It was normal. And then, we talked about, is there anything that could be contributing to your swallowing problems? And they really couldn't figure it out. So I said, tell me a little bit about your past. Tell me about, when you were growing up. Was there anything in particular that was bothersome to you? Anything that was traumatic that you experienced? And they said, I did have a little bit of a stressful childhood because my parents were very strict. And I said, were you sick a lot? Did you need antibiotics a lot? And they said, well, yeah, I mean, there were a few times where I was pretty sick and I didn't like taking my medication. And my parents would tell me that if I didn't take the medicine, that they were going to cut my throat. And so I said, oh, that's interesting. I said, have you ever thought about that a little bit? That perhaps that is translating to you today in your adult life with regards to swallowing, that perhaps that your brain is kind of remembered that, and it's causing you to have some problems with your swallowing. Because we did the endoscopy, I don't see anything wrong there. We can do other kinds of investigations to look further into it, but you think that that's something that that we should talk a little bit more about? And she, looked back and said, I never really thought about it like that. And so, the conversation continued a little bit. We peeled it back a little bit further, and then this person came back for a follow-up later on and said the swallowing was completely gone. I don't have a problem swallowing anymore. And they came in walking on their own 2 feet without using the wheelchair either as well. This is a little bit of an extreme situation, but it's definitely a true story. And this is actually really hits home the point about how there certainly could be a mind-body connection with a lot of problems that we may experience. In this case, it was a very strong connection. In many cases, it may not be the only connection, but it may be a contributing factor. And if we don't address some of these things, then we may be missing a big piece of the puzzle.
I can
So once
imagine
this
that.
person realized how this stressor from the past was impacting them in the present, they were able to unwind that and address it and acknowledge it and then deal with it and help resolve it. And I remember I was talking to my friend Dan Siegel, who's a famous psychiatrist, and I told him the story, and I said, I didn't really do anything. I didn't prescribe anything. I didn't give any therapy. And he said, oh, but you did. You actually listened to this patient. You actually talked to them about what was actually the problem. And that is where the medicine really was. It wasn't in a pill. It was in the discussion, and it was in giving the person the time of day really to talk about what their problems were. Because if nobody did that, they would still be sitting in a wheelchair thinking that they have problems swallowing.
And it seems like it takes connecting the dots with a professional who can do that in an integrative way. I mean, if not saying it just, but a psychologist may have looked at that, but the person may not quite believe that because they're not being looked at medically also. So to be able to have the confidence in someone who has this wealth of knowledge where they say, I'm sitting in front of a doctor who's actually doing the endoscopy and then listening, where they can then let go in a sense and say, okay, maybe there is something there once you look at all of those things. So it seems like connecting those dots and being guided is super important, because a lot of times, like you said, we think we'll try this and try that. But it's that wealth of knowledge that really helps to connect those dots, which is what we need, not just physically, but psychologically, to be able to get on that path to wellness ourselves, to actually walk down that path and be willing. So what happened? Did you follow up with that patient? Did getting out of the wheelchair make a difference with that person's wellness?
They did great. I mean, to the point where they wrote a letter to my chief saying that I cured them of longstanding IBS and swallowing problems and things like that. So it's really, this was really a profound example. I couldn't say that I had thousands of those specific examples where it was just that, but this really just kind of hit home the point to me that there is this very large component of mind-body connection. And if we don't acknowledge that, we may miss a lot. And so, and this is something where there's really not a test for it. The test is in the conversation, in giving the person the time to talk about different things. If you don't do that, then you're going to miss it. So my first test when you meet me in my practice is a long conversation. We can have a conversation as long as you want, but on average, around 90 minutes is what I spend talking to the person the first time when they're coming to get one of these evaluations. And so we spend a lot of time talking about things, and might not really realize until the conversation is over how some of these things from your past are really influencing your health today.
Really incredible.
Yeah,
Well,
even
what
our
are the things?
microbiome health is largely influenced from an early age. The most important time in our development of our gut microbiome is in the first 1,000 days. So think about that. That's in the first few years of life. So if, you got a lot of antibiotics when you were young, and you grew up on McDonald's and fast food, you can imagine that you might potentially have some gut problems in your older years. And even if you did clean up your diet, that some of those impacts from childhood may still be, overseeing, kind of haunting you, I guess, from the past. And there's nothing you can do about what happened in the past because it's already happened. But if you don't look and see what is going on today, then you may be at a disadvantage to understanding how you can influence the composition of your microbiome and what things we can do to try to make it a little bit better and push the envelope a bit to make things stronger for you.
Well, we're hearing so much about microbiome and the brain gut axis or correlation, and the vagus nerve and stress. And um, it seems that as a gastroenterologist and integrative medicine practitioner, that you have all of that you can look at together. And a lot of people don't realize that those are all, well, it's all integrated, but those are things that are coming up in our awareness now, because that's where the root of so many issues seem to be.
Yep. Hippocrates said all disease begins in the gut. Probably didn't know what he was talking about back then, but we're proving him correct these days in the modern ages.
So can you tell us about what we can do, where, maybe some simple things we can do, and then where we can find more information from you?
Yeah, I mean, I think simple things or tips on how we can kind of get started in our own health and wellness journey is, number one is reflect on how you live your life. What kind of diet are you eating? Are you sleeping enough? You getting 7 hours of sleep? Are you moving enough? Are you exercising? Are you doing anything to mitigate stress? Even if you think you don't have problems with stress, I can't tell you how many people that actually have blatant problems with stress actually. And I think it's almost impossible not to have stress these days in 2020, at least. how much they're enjoying life, how much they're enjoying their social interconnections, doing things that are good for them, self-compassion, and looking at what kind of products you use, what kind of toxins you're exposed to, how you're trying to mitigate your exposure to toxins, whether it's drinking filtered water or putting a reverse osmosis system in your house or having an air filtration system, making sure that you don't have mold in your house, or making sure you're using clean products, clothing, paint, things in your house that you're going to be smelling and exposing yourself to. Making sure you're eating organic or non-GMO and avoiding processed packaged foods that are high in sugar. All these things sound like, oh yeah, I know I should do these things, but why you should do these things is very important, is because a lot of us don't understand or appreciate that these things all impact our microbiome. And the microbiome, composes a majority of our immune system. So if we're talking about being healthy, losing weight, having immunity, being somebody who might have a little bit of an advantage, perhaps because your immune system is better against getting sick or against getting infections. And this is where you start. These are the easy things to do. This is low-hanging fruit, because you don't really necessarily need a prescription for any of this stuff. You just need the time and the thought to know how to organize it to do some of these things. I've written a couple of book chapters on lifestyle medicine and how they impact the microbiome. So all of these things that we just mentioned actually can influence the microbiome, can help improve the composition of the microbiome. People that exercise have a more diverse microbiome. People that eat a healthy diet with plenty of plant foods and vegetables and fruits, they have a more diverse microbiome, and they produce more short chain fatty acids, which are anti-inflammatory, which help improve your microbiome's health overall. Those who sleep better have a better composition of the microbiome. Those who mitigate stress, we have data in the telomere data and longevity that you live longer, your inflammation levels are lower, and also it helps improve your microbiome. So all of these things really improve your microbiome, and what I find fascinating is that they improve a lot of other things as well. Stress reduction may, for example, say if you meditate, may improve the composition of your microbiome, may improve that gut-brain axis, may also help improve your epigenetics. It may help, help you keep the good genes switched on and help the bad genes from switching on as well.
Wow.
And there's data on, improvement in telomere length, and telomerase activity in those who meditate. And there's also data on living longer if you meditate. So you can see how this is an example of one ingredient that has multiple influences. And this is how, when we say the body is complex, yet very simple, and how we say when you give your body the ingredients that it needs to do the job that it wants to do, it will do the best that it can. This is an example of one of those ingredients where if you give your body that ingredient, then it's just like all these reactions start going off in your body that are for your benefit because that's what it wants.
Mm.
And so these are easy things that we can all do, right off the bat without needing any testing or anything like that. This is a core part of precisionomics or precision medicine, is really understanding you and how you can modify your lifestyle. And sometimes it's hard to figure some of this stuff out on your own. So this is part of what I do in in the coaching aspect of taking care of people, is really listening to them, hearing who they are, getting to know them very well. And then you have a basis to make a recommendation for trying to do different things and helping them kind of make their way through, because everybody has a different life. You could be a busy banker on Wall Street or a stay-at-home mom, in Hawaii. And everybody's got different needs and desires, and you're not going to change their life, but you can help them understand how to modify their lifestyle within their parameters, within what their current life is.
I just got chills, and in Hawaii, they call it chicken skin with what you're saying, because I know that the people in Maui that will be seeing this, if they're not already convinced, they will be convinced, because it's that simplicity and the snowball upward effect, I think you called it,
Mm-hmm.
that it's like, well, if we didn't know that or believe that before, you just laid out a case for these simple things to do. And I want people to know that it can start with the books that you have, which I will link to below. And also you have a 4-week gut reset. And so there are simple things that you can start with. Look into some of your programs that are online, since we're in this online world right now.
Yeah, for sure. The main website is precisionclinic.com, precision with an E. So PRECISIONE, clinic.com. I have another website where I have a lot of videos and articles and stuff on drmarvinsingh.com. And I'm pretty active on social media, Instagram, Twitter, Facebook. They're all at Dr. Marvin Singh. So if anybody wants to find me or see what I'm up to, those are some good places to start. And there's contact pages on the 2 main websites. So if you want to send a message or shoot an email or something, it's pretty easy to do straight from the website.
Awesome. That is so great. Well, I'll put all those links below, and this has been really awesome.
Thank you. Thanks for having me on the show.
All right, mamas, it's those little things that we can do, right? To snowball upward and onward with our health. And we're looking out to this brand new year, a brighter, healthier new year, we're hoping, right? So now I have something really exciting for you. All those deals, those great local kind gifts that are around that you can get for your family, friends, and stocking stuffers. And as a mom in our community for now, I want to say, it's been a wonderful year, and we are going to have a couple more segments, but I hope that these proactive pandemic series has really helped you and your family to navigate your health better. I know we're getting a vaccine, but we can still think about these things for beyond the pandemic to help our families. So for now, take care, stay safe, and be well, and we'll see you next week. Aloha.